Hello everyone and welcome to my YouTube channel. Today's topic is decoding your health, what your laboratory tests reveal about your health. Have you ever wondered what secrets your blood holds? Like a secret code, our bodies communicate through blood, urine, and other fluids. Lab tests are the key to deciphering these messages. They reveal a hidden world of information about our health, often before we experience any symptoms. In this exploration, we'll delve into 5 common but powerful lab tests: the complete blood count, the basic metabolic panel, urine analysis, tumor markers, and heart disease tests. You will get to learn what your red and white blood cells say about your body, hidden health risks in your urine tests, and how the laboratory can detect early signs of diabetes, kidney disease, infections, cancer, and heart diseases. You will also learn some shocking truths your doctors may not explain. Understanding these will empower you to take control of your well-being and potentially detect serious health conditions early on. The complete blood count, or CBC, is like a census for your blood. It's a common and essential test that provides a detailed overview of your blood's health. By analyzing the different types of cells in your blood, doctors can gain valuable insights into your overall well-being and detect a variety of conditions early on. It measures the different types of cells that flow through your veins: red blood cells, white blood cells, and platelets. Each of these cells has a unique function and is crucial for maintaining your health. The CBC test can reveal important information about the number, size, and shape of these cells, which can help diagnose a range of health issues. Each cell type plays a crucial role. Red blood cells, white blood cells, and platelets all work together to keep your body functioning properly. Understanding the balance and health of these cells can provide a comprehensive picture of your body's internal environment. Red blood cells are the delivery trucks of your body, carrying oxygen to every cell. They contain a protein called hemoglobin, which binds to oxygen in the lungs and transports it to tissues throughout the body. This oxygen is essential for the production of energy and the proper functioning of your organs and tissues. Too few red blood cells, a condition called anemia, can leave you feeling tired and weak. Anemia can be caused by a variety of factors, including nutritional deficiencies, chronic diseases, or bone marrow problems. Identifying and treating anemia early can significantly improve your quality of life and prevent more serious health issues. White blood cells are your immune system's warriors, fighting off infections. They come in different types, each with a specific role in defending your body against pathogens like bacteria, viruses, and fungi. A healthy white blood cell count is essential for a robust immune response. An elevated white blood cell count can signal that your body is battling an infection. It can also indicate other conditions such as inflammation, stress, or more serious diseases like leukemia. Monitoring white blood cell levels helps doctors understand your immune system's status and guide appropriate treatments. Platelets are tiny cells that help your blood clot, preventing excessive bleeding. When you get a cut or injury, platelets rush to the site and form a plug to stop the bleeding. This process is vital for wound healing and preventing blood loss. Abnormal platelet counts can lead to bleeding disorders or increase the risk of clotting problems. The CBC provides a snapshot of these vital components, giving your doctor important clues about your overall health. By regularly monitoring your blood count, doctors can detect changes that may indicate underlying health issues, allowing for early intervention and better management of your health. Whether it's diagnosing anemia, infections, or other conditions, the CBC is a powerful tool in maintaining your well-being. The basic metabolic panel, or BMP, is like a peek under the hood of your body's engine. It measures electrolytes, minerals, and other substances that are crucial for your body to function correctly. Electrolytes, like sodium and potassium, help regulate your heartbeat and fluid balance. The BMP also checks your blood sugar levels, a key indicator of diabetes. High blood sugar, or hyperglycemia, can damage your organs over time. Kidney function is another vital aspect assessed by the BMP. Elevated levels of creatinine, a waste product filtered by your kidneys, can indicate kidney disease. The BMP, while seemingly basic, provides a wealth of information about your body's internal environment. Section 4. Secrets in your stream. The power of a simple urinalysis. A urinalysis is like examining a river to understand the health of its source. Just as a river carries signs of the environment it flows through, your urine carries clues about your body's internal environment. This simple, non-invasive test can reveal a wealth of information about your health, often before you even notice any symptoms. Your urine, though often overlooked, contains valuable information about your kidneys, bladder, and overall health. It can indicate hydration levels, detect infections, and even signal more serious conditions. By analyzing the color, clarity, and chemical composition of your urine, healthcare professionals can gain insights into your metabolic and systemic health. One of the most common findings in a urinalysis is the presence of white blood cells in the urine, often a sign of a urinary tract infection or UTI. White blood cells are part of the body's immune response, and their presence in urine usually indicates that the body is fighting off an infection in the urinary tract. UTIs are more common in women and can cause painful urination and frequent urges to go. If left untreated, they can lead to more serious kidney infections. Symptoms like a burning sensation during urination, cloudy or strong-smelling urine, and pelvic pain are common indicators. Early detection through urinalysis can lead to prompt treatment and relief. Blood in the urine, while sometimes harmless, can also be a red flag for kidney stones, infections, or even bladder cancer. Hematuria, the medical term for blood in the urine, can be visible to the naked eye or detected only under a microscope. It's crucial to investigate the cause, as it can range from minor issues to serious health concerns. Sugar in the urine, a hallmark of diabetes, highlights how this simple test can uncover serious conditions. When blood sugar levels are too high, the kidneys can't reabsorb all the glucose, leading to its presence in urine. This can be an early warning sign of diabetes, prompting further testing and management to prevent complications. Beyond these common findings, urinalysis can also detect proteins, which may indicate kidney disease, or ketones, which can be a sign of uncontrolled diabetes. Each component analyzed in a urinalysis provides a piece of the puzzle, helping to create a comprehensive picture of your health. Regular urinalysis can be a proactive step in maintaining your well-being, catching potential issues early, and ensuring timely treatment. Section 5. Whispers of warning, tumor markers, and early detection. Tumor markers are substances found in the blood, urine, or body tissues that can indicate the presence of cancer. These markers are typically proteins or other molecules produced either by the tumor itself or by the body in response to the presence of cancer. They can be detected through various tests and are often used in conjunction with other diagnostic tools to provide a more comprehensive picture of a patient's health. While not a diagnosis in themselves, elevated levels of certain tumor markers can be an early warning sign, prompting further investigation. For instance, if a patient has a family history of cancer or presents symptoms that are concerning, doctors may order tests for specific tumor markers to rule out or confirm the presence of cancer. This proactive approach can lead to earlier detection and, consequently, more effective treatment options. For example, the PSA test measures a protein called prostate-specific antigen, and elevated levels can suggest prostate cancer in men. The PSA test is one of the most well-known tumor marker tests and has been instrumental in the early detection of prostate cancer, significantly improving survival rates. However, it's important to note that elevated PSA levels can also be caused by non-cancerous conditions, such as prostatitis or benign prostatic hyperplasia. The CA-125 test, often used to monitor ovarian cancer, measures a protein found on the surface of ovarian cancer cells. This test is particularly useful for women who are at high risk of ovarian cancer or who have already been diagnosed and are undergoing treatment. By tracking CA-125 levels over time, doctors can assess how well a patient is responding to treatment and make necessary adjustments to their care plan. It's important to remember that tumor markers are not foolproof. They can be elevated for reasons other than cancer, such as inflammation, infection, or other benign conditions. Additionally, not all cancers produce detectable tumor markers, which means that a normal tumor marker level does not necessarily rule out the presence of cancer. This is why tumor markers are typically used in combination with other diagnostic tests, such as imaging studies and biopsies, to provide a more accurate diagnosis. They can be elevated for reasons other than cancer, and not all cancers produce detectable tumor markers. For example, certain benign conditions like liver cirrhosis or hepatitis can cause elevated levels of the tumor marker AFP, which is also associated with liver cancer. This overlap underscores the importance of a comprehensive diagnostic approach that considers all possible factors and uses multiple methods to arrive at a diagnosis. However, When used appropriately, they can be a valuable tool in the fight against cancer. Tumor markers can help in monitoring the effectiveness of treatment, detecting recurrences, and even in some cases, guiding treatment decisions. For patients and healthcare providers, understanding the role and limitations of tumor markers is crucial in making informed decisions about cancer care. By integrating tumor marker tests with other diagnostic tools, we can improve early detection, tailor treatments to individual patients, and ultimately enhance outcomes in the battle against cancer. Section 6. The heart of the matter tests for your most vital organ. Heart disease remains a leading cause of death worldwide, but early detection can be a lifesaver. Cholesterol tests, a routine part of a blood workup, measure the levels of fats in your blood. High levels of LDL cholesterol, often dubbed bad cholesterol, can clog your arteries, increasing your risk of heart attack and stroke. Electrocardiograms, or EKGs, record your heart's electrical activity, revealing any irregular heartbeats or arrhythmias. Echocardiograms use sound waves to create images of your heart, allowing doctors to assess its structure and function. These tests, along with blood pressure monitoring, provide a comprehensive picture of your cardiovascular health. Thank you for watching. Please like and share this video to help others understand their health. Subscribe for more health topics and medical insights. Our next video will be on complete blood count. Everything about CBC and why it is important will be revealed. You don't want to miss it. If you have ever been confused about your lab test, please comment below and let us discuss. Thank you. Don't forget to subscribe. Thank you.